Africa's Mpox cases have risen to 20 after 4 more cases were recorded in Gauteng and in KwaZulu-Natal. The number of fatalities remains at 3 since the start of the outbreak in May. Now, outbreak response teams have been activated for new cases, and another batch of Mpox-specific treatment is expected to arrive in the country in the next few weeks. All right, and that brings us to our discussion with the WHO. Well, the WHO's team lead for emergency preparedness and response in South Africa. Dr. Joseph Walama is also a medical epidemiologist. Dr. Walama, it's great to talk to you. Thanks very much indeed for coming onto the program. How concerned should we be, and certainly how concerned is the WHO, Dr. Walama, around South Africa's cases increasing, not exponentially, by 4, it's now at 20. Should we be concerned?
Thank you for hosting me, and it's good to be hosted here today. Yes, indeed, we should be concerned about the cases of Mpox in South Africa. One, considering that the country is not endemic for the disease. 2, the fact that given that the current global multi-country Mpox outbreak started in 2022, peaked around August 2022 and has actually been declining since the beginning of last year. It really stands out, the South African outbreak stands out as one of the few countries where we have increasing Mpox cases. So we really need to be concerned given that in as much as globally the cases have been declining, we see an increase here. The other challenge also we see in South Africa is that most of the 20 cases are severe cases. So that's probably a sign that there could be more cases out there that we are missing. And the reason why we've actually been working with government and partners to strengthen the surveillance for cases. The other reason why we should be worried is that Mpox tends to be severe in individuals who have immune suppressive conditions. So in individuals who may have HIV, especially HIV that is not well controlled, they may suffer from severe Mpox disease when they get infected. Yeah, so these are some of the reasons why we should really be concerned about the Mpox situation in South Africa. Thank you.
So Dr. Walama, at what stage then do we talk about preventative vaccination?
Preventive vaccination is actually already being considered. We have recommendations already from the National Advisory Group on Immunization. They've actually advised that high-risk groups, especially the ones that are currently affected by the current outbreak, are prioritized for vaccination. So this would include individuals who identify as gay, lesbian, or men who have sex with men, transgender, but also contacts of confirmed cases should actually be prioritized for vaccination within, especially within 4 days of exposure, but also not more than 14 days after exposure, but again, before they develop symptoms, those should be prioritized for vaccination. So there is already a process underway to secure vaccines for the country. The quantification has been completed with support from WHO, and again, WHO is facilitating the vaccine acquisition discussions with potential donor member states and manufacturers.
And yet, Dr. Walama, as you and I continue our discussion, we are waiting for the health department to join us. But the amounts of Mpox-specific treatment that have been dispatched to South Africa. We had a batch that was delivered a few weeks ago, quite a small batch, I think around 20 or so. You'll know the numbers better than I do. And then we've got another batch of Mpox-specific treatment arriving in the country in the next few weeks. But my point is the batches themselves are quite small, aren't they? They're not really meant to address sort of a wide-ranging or a real outbreak of Mpox in the country?
Yeah, you should understand that the drug we are using, tecovirimat, or the trade name Mpox, is primarily licensed by the U.S. Food and Drug Administration for use for smallpox, which was eradicated in 1980. So most of this is maintained, for example, by WHO and a couple of other countries as reserve stock in the event that probably smallpox emerges. The same drug is also effective for Mpox and has actually been licensed by several countries, the European Medical Agency, but also the UK for Mpox treatment, and it's actually known to be effective in preventing severe Mpox symptoms. So currently what we are doing is, well, it may appear that the amounts of doses we brought in are few, but I think these are also titrated to, they have been adjusted to the cases that we are seeing. We've so far brought in 15 treatment courses, and as of the beginning of this week, we had at least 9 treatment courses left in the country. Yesterday, we finalized arrangements with the National Department of Health, our global offices in Geneva, to ship another 50 treatment courses. So we actually, we're bringing in a few as we monitor the situation as it evolves. And we're also working with the government and other stakeholders like the University of Cape Town to do modeling studies to predict, or to do modeling to predict how this outbreak may evolve. And this will eventually inform our planning to avail the supplies in terms of diagnostics, medicines like tecovirimat, and vaccines that will be required to eliminate Mpox from the country.
And Dr. Walama, you've talked about the trajectory of the outbreak. Given what you know about the situation here in South Africa and the cases of Mpox we have so far, you've said the issue is that most of the 20 cases we have confirmed here in South Africa, most of them are serious. What does that tell you about how this disease will develop over the coming months?
This is subject to the modeling that we actually doing, but yes, again, we actually we continue to see that this disease, for example, will continue to affect the groups that are affected now, especially networks of groups who identify as men who have sex with men. But we are making inroads to ensure that we strengthen the messaging in these high-risk groups, like individuals who identify as men who have sex with men, the transgender men. We've also seen quite a significant proportion of these cases having comorbidities like HIV. So we're actually working with the existing HIV programs to ensure that Mpox control is integrated within the routine services to be sure that as part of the routine healthcare delivery, for example, for HIV care, but also the routine services offered for key services, we integrate Mpox prevention and control services, including vaccination, but also the messaging that is required, proper screening to ensure that new cases are diagnosed and started on treatment in time. This treatment works very well if started within the first few days of onset of illness. So working with the key populations, programs like HIV, we believe that even when we see severe cases reported in key populations, we will be able to get on top of the situation and eliminate Mpox from South Africa in the next few months.
And I suppose the inroads that we have made here in South Africa insofar as HIV treatment and prevention is concerned, it's something that we can take lessons from as we now face this issue of Mpox.
Absolutely. So we are really working with all the partners who are working in this space to really utilize the lessons learned, for example, in managing STIs, to be sure that clinicians, for example, are up to scratch with promptly identifying and requesting the necessary tests to identify new cases as soon as possible. Utilizing the existing tools to ensure that, for example, all new cases are able to promptly notify the people they've actually been exposed to about their diagnosis, so that whoever has a partner they've been exposed to, the partners are informed in time to self-monitor and to initiate the preventive measures and to promptly seek care when the symptoms start. And we are using also best practices that have been used in other countries to manage Mpox. So there have been countries in Western Europe, in the Americas, that have actually a number of best practices that we are also deploying here to be sure that we actually start on a slate that uses best practices to ensure we timely contain the transmission of Mpox in the country.
Dr. Joseph Walama, let me thank you for your time this afternoon, and apologies we couldn't get the stance of the National Health Department here in South Africa, but I think a clear picture being painted on the part of the WHO's team lead for emergency preparedness and response in South Africa. Dr. Joseph Walama is also a medical epidemiologist. Thanks very much indeed for joining us.